What about head and neck radiation? And this is an area that I see quite a bit because I treat a lot of patients that have had radiation in cancer therapy. And when you add chemotherapy to that, it even complicates things much more. And we have these vascular and wound healing problems. So this is a patient who is really has a failing dentition, and the discussion went on quite a long time of how we were going to treat this patient. We decided to do immediate implants with immediate provisionalization. Obviously, an all-on X type of procedure, but certainly on a very, very strict liquid diet, knowing that there could be failures because of his radiation compromise. You can see when the teeth were removed, the quality of bone is not wonderful. You can't see a lot of good vascularity here. It's still, again, a fairly low ISQ reading, and our implants placed with the provisional restoration intact, and him knowing that he really needed to be extremely careful because the implant failure rate is quite high because of his radiation. But the reading of 65 gave me a little bit of confidence, more than I would have definitely had without it, to do this provisional restoration. And so this is him. And actually, it's been about 4 years since his prosthesis has been placed, and he's been doing very well and didn't have any loss of his implants. So this is him before and after.